and then all right, over to you, Rabbi Dorff.
Thank you. So today we're going to be talking about the pandemic, both in its physical aspects and its emotional and psychological aspects. And then next week we're talking about end of life issues. So just so you know what the game plan is, as it were. COVID, of course, has been, well, the word that always keeps on coming to my mind, discombobulating, right? It has upset virtually everything in our lives. And certainly all of the assumptions we've made about how we gather families together, how we have meetings, how we go to shul, how we do healthcare, how we even go to sports events or movies or whatever. All of those things have been really discombobulated by the virus. And what the Committee on Jewish Law and Standards has done over the course of the last almost 2 years now has tried to respond to a number of different aspects of how we can continue on as people and as conservative Jews during this pandemic. So I'm going to, at the beginning, I'm just going to talk about some of the things that are not in healthcare, and then I'm going to talk about the healthcare stuff. I mean, some of the things, well, the last time I remember that we gathered without even thinking about this virus was Purim 2020. I remember we had a Purim party and nobody was even thinking about it, right? 4 weeks later, Pesach already, you couldn't gather together and all of that. And there were questions about do you have a Zoom Seder? It was the first one that we ever had in our family. There were shortages of Passover foods, kosher Passover foods in the markets, all kinds of things like that, already on Passover of that year. And then later, of course, what do you do on Shabbat with services and youth groups and all of that? And then rabbis were afraid of it, but it certainly happened. We had the high holidays during the pandemic, and not only once, but twice. And how do you do that? All of those kinds of things. And then also life cycle events. How do you do a Brit Milah? I mean, babies were being born, or for that matter, a welcoming ceremony for girls. How do you do those and stay safe? What do you do with bar and bat mitzvahs? I mean, all kinds of things were happening with that. My own granddaughter was supposed to be bat mitzvah in May of that year, and that got postponed to October of that year, and then it was on Zoom altogether. She just had her 14th birthday. I mean, it was, what can I tell you? And then let alone weddings. I mean, weddings got postponed. Some of them are still postponed, right? And then what do you do with second weddings? I actually wrote a tshuva about that. What happens if a couple got married during the pandemic with just 10 people, a basic minyan, and that was it. But now they want to have a celebration with all their family and friends, right? And they want to have a ceremony. Are you allowed to simply repeat the first ceremony, or does that involve brachot that are said in vain, which you're not allowed to do? So are you allowed to do that? What about if the groom puts on the bride, Harei at mikudeshet li b'tavad zo? Is that well, what I was arguing was that it was a performative utterance the first time he did it. He was making something happen. And it's a declarative remark the second time he does it. He's describing what's going on as opposed to performing a legal act. And so therefore he may use the same formula. That's what I argued anyway. Not all of my colleagues on the law committee were happy with that, but what can I tell you? What else is new? The thing is that, and then funerals. I mean, I don't know what it was in Detroit, but in Los Angeles, there was a maximum of 10 people at a funeral, and that was outdoors. And what do you do with Shiva and all of that? I mean, so there were a number of tshuvot about life cycle events and about services and things in that order. All of which you can find on the website of the Committee on Jewish Law and Standards if you're interested in them. It's on the public side of the website. Let me just remind you that what you do is, and you can ask Rabbi Rubenstein when if you want some help with this afterward. But you just Google Rabbinical Assembly, and then you go on the tab that says Jewish law.
Yeah, I'll put it in the chat as well.
You'll put it in the chat. Good. Okay. And you can find all of these rabbinic rulings, these tshuvot, about all of these things that I just mentioned on that website. What I want to talk about today is the healthcare aspects of all of this. Some of the healthcare aspects of it were directed more at public health issues than at individual issues. But let me talk to the individual issues first, simply because those are the things that I guess everybody will be familiar with. We have a tshuva about vaccinations once the vaccine became available. Let me just say very strongly, there is no Jewish reason for refusing to be vaccinated. There are medical reasons. There's a very small percentage of the population who have immune problems, immunosuppressed because they underwent cancer therapy or something on that order, radiation therapy, right? So there's a small percentage of the population that really should not be vaccinated for that reason. But there is no Jewish reason to avoid vaccination. As a matter of fact, quite the opposite. There's every Jewish reason to require it. And that now means not only doubly vaccinated, but also with a booster shot. And in Israel, they're giving a second booster shot already, although it's not completely clear whether it's working to the extent that they thought it would. But the point is that, and why is that Jewishly required? It's Jewishly required for two reasons. One, because, as I mentioned to you last time, you as a Jew have an obligation to God to take care of your body. And taking care of your body means preventive ways of doing it, as well as curative ways of doing it. And as usual, an ounce of prevention is worth a pound of cure. So I think that's Ben Franklin. That's not Judaism, but anyway, but it's true nevertheless. And the point is that it's we're not talking about experimental vaccines anymore. We're talking about vaccines that have been given to hundreds of millions of people and have been able to either prevent infection altogether or to prevent serious consequences of prevention as a result of vaccine. And I'm one example of that. I was vaccinated as soon as I was eligible, and then I was vaccinated a second time as soon as I was eligible. And then they approved the booster on Friday, and the following Monday, I got the booster. And guess what? Last Sunday, I tested positive. I had, the only reason why I even got tested was because I was sneezing a lot and I had a sore throat. And, in the age of, normally I would just think that that's a cold, right? But I didn't know whether it was a cold or COVID. And the truth of the matter is that the week before, my granddaughter was home from college and she had tested positive. So I was afraid that it had been transferred, and lo and behold, it was. So that meant that I was teaching my classes again this week online. And we started teaching this past week, and it was in person, outdoors with masks and all of that, but it was in person. But I was online again this week. Thankfully, I'm no longer sneezing and I don't have a sore throat, and I will be retested again on Sunday, and hopefully it'll be negative by this time. But I'm sure I grew up with asthma, and I told you last time I grew up with weakness in my bronchial tubes. I've had bronchitis 15, 20 times in my life, right? And the virus, especially the Delta version of the virus, attacked the lungs. So I was frankly really, really very afraid of that. I'm 78. I'm, not in my 20s. And so I'm among the most vulnerable. And it's, as far as I can tell, the vaccines really worked. And you have a duty in the Jewish tradition, not only to yourself on pragmatic grounds, but also to God, and to engage in this form of preventive medicine. But the second reason is you are also, as I talked to you about last time, not an individual living on an island. You live in a community, in a family, and in a community. and you have a duty to prevent them from getting sick as well. And this is one very clear way to do that. So both on an individual level and on a communal level, you have a duty to get vaccinated. And you can see that in Rabbi Micah Peltz's Tshuva on vaccination that is on that website. You also have a duty to wear a mask, at least indoors. It depends upon where you're living these days as to whether you need to wear them outdoors, as to exactly what the degree of infection in your particular region of the country. You have to talk to public health officials in your region of the country to find out what's advisable. And do social distancing and things in that order. So all of those things are very much part of what the Jewish tradition would say in regard to responding to the pandemic on an individual level. But it also creates a number of communal problems. And this was especially so when the vaccine first hit, when the virus first hit, and there were no vaccines. I'm talking like March 2020 until I guess it was December 2020 when we first got the vaccines. And then there was a real outbreak of very serious cases of the pandemic, which led to a shortage of ventilators and rooms in emergency centers and things on that order. Since the 1980s, I have been on the ethics committee of UCLA Medical Center. We normally meet once a month on Tuesday afternoons from 4 to 6. But once the virus hit, we had weekly meetings for 3 to 4 hours, trying to figure out a policy for what's called triage. That is, for deciding when who gets what when you don't have enough for everybody. And in particular, that was in regard to, at that time, ventilators, and also, to a certain extent, rooms in the emergency center and in the hospital altogether. And also, given the fact that all of these hospital rooms and hospital machines were being used by COVID patients, what does that mean for people who have other diseases? It certainly meant right away that, quote unquote, elective surgeries were being postponed. But elective means things that are often very painful. I mean, things like hip surgeries and knee surgeries and things on that order, right? And let alone cancer treatments and heart transplants and transplants of all sorts, and heart disease. I mean, diseases of all sorts. Those didn't go away when COVID came, and hospitals found themselves struggling to keep up. So these meetings once a week at UCLA were about triage policies. The word comes from the military context. You have people wounded on the battlefield. You can't save them all, then whom do you save? And the general rule in the military context is two things. Number one, you save those that you're most likely to be able to return to health, and two, are most likely to be able to help you continue to fight the war. So in the military context, that's what happens with triage. So what that would lead to would be a hospital policy that would say that you save those that you have the most likelihood of restoring to discharge, to health, in the sense of discharge from the hospital. I mean, nobody knows how long they're going to live and in what condition and all of that. But the criterion would be restoring people to discharge from the hospital, healthy enough to go home, right? What happens afterward is anybody's guess, but at least to that. The problem, then we had a meeting with 3 African-American physicians on staff who pointed out that if we did it that way, then that would simply reinforce structural racism, because the people who are most likely to be able to have health insurance to begin with are people in the at least middle to higher socioeconomic parts of society. We still even with Obamacare, we still have 30-some million Americans that don't have health care altogether, right? And they would be the ones that would be least likely to be able to find themselves to get a room in the emergency center. And secondly, they would be the ones that would least likely trust medicine, because there's a lot of distrust of medicine in the African-American community, and then somewhat less, but almost as much in the Hispanic community. And so consequently, if we were to do triage simply on the basis of those physical characteristics, namely who's most likely to be able to be treated and then discharged to go home, then that would be reinforcing the kind of structural racism in our society. On the other hand, you couldn't do the opposite, right? The opposite would be a kind of affirmative action thing, about which there has been a lot of Supreme Court cases in regard to education. Let's say you had, what I mean by that is, let's say you had two people, one white, one black, and they were of equal status medically. They were each, let's say they each needed ventilators, and they were, let's say, roughly the same age, and had the same health status in terms of pre-existing conditions and all of that. You don't necessarily, it would be unfair to prefer the black person over the white person in order to try to circumvent some of the structural racism that has happened in the past, right? It's the same kind of issues that we have in education vis-a-vis affirmative action. So in the end, with a lot of, I must say, ambivalence and fear and trepidation, we ultimately used the policy that we originally had, namely that the best that we could do is to try to get as many people to a point in their lives where they could be discharged from the hospital, and we couldn't resolve the racial structuralism in our society at UCLA. We didn't want to contribute to it, but on the other hand, we couldn't resolve it either. That's a much bigger problem. When it came time to looking at this from a Jewish perspective, Rabbi Daniel Nevins, who is the immediate former dean of the rabbinical school at Jewish Theological Seminary and is now running Golda Ach Academy at Solomon Schechter Day School in West Orange, New Jersey.
We know Danny Nevins here in Detroit.
Oh, it's from Detroit, yes. What am I thinking? Yes. He and I have been very good friends from the time he was a rabbinical. I was on the law committee. When he was in rabbinical school, he was secretary of the law committee. That's how we first got to know each other. And his dad, Michael Nevins, a doctor, helped us with some of our first true vote about end-of-life issues that I'll talk about next time. Anyway, we're just very good friends. And he and I had this wonderful cross-country chevruta. This is in April, May, and June of 2020 about triage. And at the beginning, we were 180 degrees apart on all kinds of things. And we ended up writing two different true vote, coming to the same conclusions, but from very different resources within our tradition. He really wanted to maintain, and did to the very end, he wanted to maintain a clinical medicine view of the whole thing. Namely, that and even though the hospitals were being overwhelmed, doctors needed to treat the person in front of them to the greatest extent that they could. Now, I would love to be able to do that, but what I pointed out was that we're not in a situation in which doctors have the luxury to do that. We are in a public health emergency, and in a public health emergency, you have to deal with this on a public health level, not just on a clinical medicine level, until you get back to the point, God willing, soon, in which you have both the personnel and the resources, medicines, rooms, that kind of thing, to be able to treat people to the extent that they need to be treated in order to regain their health. So we called on, if you look at those two different rabbinic rulings, you will see that we were using very different sources within our tradition to come to our conclusion. But in the end, we decided to come to the same conclusions about how you decide who gets what and why. Again, if you're interested, and aside from those two true vote, if you're interested in this conversation generally, you can find that in chapter 12 of the book I mentioned last time, Matters of Life and Death. This book that I did on Jewish medical ethics. Matters of Life and Death, a Jewish approach to modern medical ethics. Chapter 12, this was written in 1998, long before the pandemic, talks about Jewish sources about who gets medical interventions and medical care altogether, and who pays for it. Those two questions are addressed in chapter 12 of that book, from the point of view of a variety of different Jewish sources. So there are those triage issues on a public health issue, on a public health level that had to be addressed, and that were addressed by the Committee on Jewish Law and Standards, by Rabbi Nevins and me, in these two varying ways. There are also, questions about that really go beyond this, and that I think are all too often ignored. And those are the mental health issues that the virus has really shown a very sharp light on. I'm just going to, just because it's very recent, I'm just going to read to you a little bit from the op-ed by David Brooks in the New York Times, Friday, the January 14th. So just last Friday. In June, a statistic, a statistic floated across my desk that startled me. In 2020, the number of miles Americans drove fell 13% because of the pandemic, but the number of traffic deaths rose 7%. I couldn't figure it out. Why would Americans be driving so much more recklessly during the pandemic? But then in the first half of 2021, according to the National Highway Traffic Safety Administration, motor vehicle deaths were up 18.4%, even over 2020. Contributing factors, according to the agency, included driving under the influence, speeding, and failure to wear a seatbelt. Why are so many Americans driving irresponsibly? While gloomy numbers like these were rattling around in my brain, a Substack article from Matthew Iglesias hit my inbox this week. It was titled, "All Kinds of Bad Behavior is on the Rise." Not only is reckless driving on the rise, Iglesias pointed out, but the number of altercations on planes has exploded. The murder rate is surging in cities. Drug overdoses are increasing. Americans are drinking more. Nurses say patients are getting more abusive, and so on and so on. Moreover than that, in October, CNN ran a story titled "Hate Crime Reports in U.S. Surge to the Highest Level in 12 Years, FBI says." And some of those hate crimes are against Jews, of course, right? Including some of the attacks just this past week on a synagogue in Texas, and the Tree of Life thing last year in Poway, California. I mean, problems, rising anti-Semitism, anti-Blacks, anti-Asians, anti-Muslims, all of that, right? The number of gun purchases has soared. In January 2021, more than 2 million firearms were bought, the Washington Post reported, an 80% year-over-year spike, and the third highest one-month total on record. As American hostility toward one another seems to be growing, their care for one another seems to be falling. A study from Indiana University's Lilly Family School of Philanthropy found that the share of Americans who give to charity is steadily declining. In 2000, 66.2% of households made a charitable donation. By 2008, but by 2018, only 66% of households made a charitable donation. By 2018, only 49.6% did, right? And this is not even to mention the parts of the deteriorating climate that are hard to quantify: the rise in polarization, hatred, anger, and fear. High rates of depression, suicide, and loneliness that have dogged Americans all the more during this pandemic. I wrote, one of the chuvot I wrote for the law committee is on loneliness during the pandemic. Because, as I mentioned to you last time, the Jewish tradition, unlike the Western philosophical tradition, the Jewish tradition very much understood the mental emotional and cognitive parts of our existence. Cognitive is what we will, what we desire, right? The mental, the emotional, and the cognitive parts of our tradition, of our being, as thoroughly integrated into the physical parts of our being, and vice versa, so that the way we treat our body has a major effect on what we how we feel about ourselves, how we think about ourselves, and what we desire. And conversely, how we think about ourselves, how we feel about ourselves, and what we desire has a major effect on our bodies, right? These kinds of emotional and psychiatric problems, and now social problems with guns and hatred crimes and what the article did not mention, also in schools, major problems of discipline within schools, major problems of kids being able to learn as a result, and then they take it out on their friends, and they take it out on their families, and all of that, right? All of this is just really critical in our time. My wife and I have 4 children. As it happens, it's girl, boy, girl, boy. Both of our daughters are involved in mental health issues. My older daughter is a psychologist. My younger daughter is a social worker. They are overwhelmed, as are people in mental health generally, as a result of the need that people have of getting help for their distress, for their anxiety, for their inability to get along with people anymore. You know, you love your family, but maybe not 24/7, right? You need to have some outlet with other people, and it's become much harder to do that during the pandemic. So one of the things that I say in that tshuva, and that I want to really repeat here as forcefully as I can, is that it is really important. If you can't get out, you may not be able to get out and touch someone during the pandemic, but it really is important to very consciously make connections to other people in whatever way you can, whether it's on Zoom or on FaceTime or the telephone. Yeah, it still works. Okay. It is really important to be in touch with other people. It is also important to tell people that you appreciate them and that you love the people that you love. That has always been important, but it has been even more important now during the pandemic, because people really need to hear that when they're feeling down. They need to hear it in general, but they really need to feel it, to feel that when they're feeling down. And it's something I'm going to be very blunt here. It's something that women are much better at than men. Women are much more likely to have conversations with friends over the phone long before the pandemic than men are. So guys, you have to step up here now and begin to actively think about having conversations with friends and colleagues and family members and all of that, even if normally you would not have done that because you would have just assumed that everybody was fine and you'll get together when you get together. But it really is, and the fact that we're not able to see each other in shul as often as we were able to do before, share kiddush together, all of that, right, is makes it really much harder to satisfy our own psychological and emotional needs, let alone those of people that we really care about. The thing I think that comes out of this is from a Jewish perspective, as well as a general one, but especially from a Jewish perspective here now, is that we really need to recognize Al tifrosh min hatzibur. Do not separate yourself from the community. Goes back to Hillel, right? It's not good for a person to live alone. We talked about this last time, right? It's really important to be in touch with other people because we are seeing the results of people not doing that in terms of anxiety and depression and alcoholism and suicide and all kinds of obstreperous behavior in all kinds of places. including car accidents and things like that. That's the thing I think that really needs to be front and center. Do take care of your physical health. By all means, get vaccinated. And if you get a cold or something like that, go and get tested to see whether it's just a cold or whether it is indeed COVID. And if it is COVID, you need to quarantine yourself for whatever the amount is, and you need to take whatever medications you need. I mean, in my case, it was Sudafed and some Tylenol, and it was fine. But you need to do that in order to take care of yourself, right? Because again, if you don't take care of yourself, you won't be able to take care of anybody else. So it's really important to do that. That's not being selfish. That's not being narcissistic. That's just being real. And that's fulfilling the obligations you have as a Jew, let alone, I would say, as a human being, but we'll leave that as it is. All right, I want to leave time for questions. So let me do that now, and we'll go from there. Okay, go ahead.
Why don't we ask people to raise their hands, either by Zoom, or you just sort of wave at me and I'll try and find you over there, and we can have people open up their sound. Okay, great. Ali Lupovich, go right ahead.
Hi, everybody. Thank you, Rabbi Dorff. It's very, very, very interesting and informative as usual. So let me ask you a question you haven't spoken about directly, but it's been perplexing me for a long time. This is about, this notion of vaccination. I mean, I think you pointed out, and I think it's pretty clear that, I mean, as far as Jewish sources go, there's a preponderance of sources that say to get vaccinated, and a much, much smaller number. If you reach far enough, you could find some rationalization for not getting vaccinated. Mm-hmm. I think, on the get vaccinated side, there are more mainstream sources. So if we were lining up the testimony, the Rambam, the Ramah, the Maharil, the Chazon Ish, I mean, the big names say get vaccinated. And so I guess given that, I understand why those who choose not to get vaccinated are making it for non-Jewish reasons, let's say for American reasons, or that somehow that odd notion that this is a freedom issue.
Right.
But what really perplexes me is that those who posture themselves as being pious, the most observant members of our community, how is it that they're finding some Jewish rationalization for not getting vaccinated? What's your impression there? I mean, I have sort of my own notions, but I would be curious to hear why, for example, how it is a Chabadnik is not getting vaccinated.
Yeah, it is indeed perplexing, no question about it. And I must say that I want to be very clear here. The modern Orthodox are not on that wavelength, right? The modern Orthodox have all said that you must get vaccinated and you must take proper healthcare things. So this is not an anti-Orthodox thing per se, right? But the Haredi people have really violated basically everything in the book in regard to dealing with this pandemic. Now, why? At least as far as I have read, there are primarily two reasons. There may be more. One is they have a distrust of modernity generally. They live in very isolated confines. The men never study anything outside of rabbinic literature, right? And that's part of the reason why they can't get jobs. And in Israel, this is even worse. In Israel, the Black Hat community has been on the dole from day one. And I'm a past president of Jewish Family Service, so I do a lot of this stuff on mental health issues. The amount of family violence in the Black Hat community is much greater than it is in the general community. And it's in part because men don't feel as if they're contributing, and they really are, and they are separated from women very early on, and don't know how to interact with women in a good way, right? So part of it, I think, is a distrust of modernity generally, including medicine, and part of it is their piety, right? In other words, it's we're supposed to daven every day, and we're supposed to daven in a minyan, and we're supposed to be together all on Shabbat and go to weddings and funerals and all of that, right? And who are these people, including a lot of Jews, like the current head of the CDC? Who are these people who are telling us that we shouldn't do that for health reasons, right? What authority do they have? That's not God, that's a human being, right? Now, the fact that they are also suffering much higher rates of COVID than the general population, you would think would alert them to the fact that maybe something's wrong here, right? What's wrong with this picture? You would think. And to some degree, more in America than in Israel, to some degree it has. But in certain conclaves of Haredi people, it is not. And they unfortunately are dying at much higher rates because of this. Look, I mean, there are many, many, many reasons why I am a conservative Jew and not an Orthodox Jew or a Reform Jew. And even more reasons why I'm not a Haredi Jew. Okay, so to be very honest, I'm guessing here, okay? But to the extent that I've read about it, I think those are the two primary reasons that they are not falling into line with proper COVID protections.
Can I just follow up? But the reasons you laid out, the distrust of modernity, and they're only studying Jewish sources, given that the instruction to vaccinate isn't only coming from modernity, it's actually coming from these very sources that they've confined themselves to. One would think. Now, I agree with you. The Haredi community in particular, they're an odd group, and they often don't make sense. But I was wondering if I could just, there's one notion, let me run it by you, and just to get your impression what you think. I think this is especially true of the Chabad community. In my mind, there is no doubt that if Menachem Schneerson were still alive, he would have told all the Chabadniks to get vaccinated on day one, because in addition to being a man of deep piety and learning and spirituality, he was also a man of science. In some ways, he was a latter-day version of the Rambam. And in that world, and in the Chabad world, they're very accustomed to having this commanding voice. And for 30 years now, they've been without it.
Yes.
And do you think the fact that that's even an issue in the Chabad community isn't only the distrust of modernity, these other things, but they don't have a Rebbe to tell them to do it, and they're just hardwired to need that commanding arbitrary voice?
Well, I think you're right about that. And I think I'm going to give you another example of this long before the pandemic, right? And I think it was 1964 that the Surgeon General in the United States said that smoking is carcinogenic, right? It causes cancer. Okay, so starting in 1974, I started team teaching a course on Jewish law at the law school at UCLA with Arthur Rosette, and we later wrote a book together on Jewish law with comparisons to American law. And one of the examples we use is eye for an eye, tooth for a tooth, right? Personal injury, which in the contemporary period, by the time you get to the Mishnah, it's not only that you're not allowed to harm somebody else, but you're also not allowed to harm yourself. This is already in the Mishnah in Bava Kama chapter 8, okay? Because largely based upon the theological grounds that I was talking about last time, right? So you're not allowed to harm yourself. So now the Surgeon General comes out with talking about the effects of smoking. So in the book that we put together that came out in 1988, we have tshuvot from the Reform movement, the conservative movement, and the Orthodox world on smoking. So Rabbi Solomon Freehoff in the Reform movement says, we now know that smoking is dangerous for your health. You're not allowed to smoke in the Reform movement. Rabbi Seymour Siegel, past chair of the law committee, who himself was a smoker and identifies himself as a smoker, and talks about the fact that because he was an observant Jew, miraculously, Friday at sunset, he was able to stop. And then Saturday at sunset, all of a sudden he had to smoke again, right? But now that we know that it is dangerous for your health, you may not smoke. Rabbi J. David Bleich of Yeshiva University, who basically says no to everything. You don't have to read his stuff, right? That's an exaggeration, but he really is on the very right wing of the modern Orthodox world, right? Wrote a tshuva in 1977, in which he said, Well, it's certainly not smart to smoke because we now know what happens medically, right? But to say that it's against the law is going too far, right? And why is it going too far? Because every single puff that you take on the cigarette does not cause cancer. It's only the cumulative effect of the puffs that cause cancer. So therefore, every puff is permitted. Now, why was he doing that? This is a really interesting thing in terms of the sociology of halakha. Well, it's primarily because all these yeshiva guys were smoking, right? And he probably knew that, if he were to say that it was against the law, it would just be ignored. So rather than have the law ignored, he would rather have it, rather say that, well, there's a way of permitting it in some way, right? There's a very funny joke about this, by the way, right? The Surgeon General says that smoking is injurious to your health, right? So the Reform movement says, well, it doesn't matter because we don't observe Jewish law anyway. In the conservative movement, you can only smoke out. You may not smoke in your home, right? In the Orthodox world, they sell their lungs to Gentiles, right? It's just a joke, okay, right? But the point that I'm after here is that in things like smoking as well, long before the pandemic, right? There's really and even in the modern Orthodox world, right? There is a certain kind of degree to which they need to compromise their commitment to modernity in order to do what they think they need to do Jewishly. Part of what the conservative movement is all about, and part of the reason why I'm very much committed to it, is a commitment to integrate tradition with modernity, right? You take both of them very seriously, and that means that that requires judgment calls. It's much easier to go to one end of the spectrum or the other, right? It's much harder to take a middle position in which you have to make judgment calls about how are you integrating tradition with modernity. But I think that's where reality is, and that's where sanity is, and I think that's where authentic Judaism is. I'm not partisan, right? There's a reason why I'm a conservative rabbi. Okay.
And why we're conservative Jews.
There you go, right on.
I think we win the authenticity contest on this one. If there is such a competition, we definitely win this one.
Right on.
Rabbi Dorff, should we look for a few more questions, or
Please
did you
go
want to?
right ahead. Yes,
Okay,
go
great.
ahead.
Floor is still open. Otherwise, I will have a question. But
Okay.
we're still pausing for. Okay, so Davy Rosen, great. Go right ahead.
Oh, sorry, I've got a crying kid in the background.
Oh, hello
Hi,
there.
Rabbi Dorff. Wonderful
Hi.
to see you.
It's been a while.
For some of the tshuvo and some of the things that congregations have done during the pandemic in order to get people to still be connecting, are tshuvo that are applied to the pandemic in particular, and do you see any of that having ramifications going forward, hopefully one day, God willing, when we're able to really
Right.
be in person without concern?
Right. Yeah, Davey, that is the question these days, right? As a matter of fact, there is a tshuva that Rabbi Josh Heller wrote about how do we know when the pandemic is over, such that the specific leniencies that we have used during the pandemic are now put aside, right? And we go back to some kind of normalcy, as it were, right? And it's a really interesting tshuva, by the way, because he talks about what how you would go about measuring that in terms of this. And I must say that, well, my son-in-law, who also is my rabbi, he's the rabbi of the synagogue to which we belong, wrote Rabbi Adam Kligfeld wrote a really, what should I say, poignant article in this last month's synagogue bulletin, in which he was sort of, wishing for the days in which we could all come together on Shabbat morning. We have a variety of different services on Shabbat morning in our synagogue for adults, and then youth services and children's things and all of that. We come together for Kiddush, right? I mean, oh my, and he said, oh, for the vegetarian chant that I haven't tasted in 2 years, right? Yeah, right. And just the ability to be together. I mean, it's and a real worry about what, will people come back once they have sort of tasted the convenience of just getting up, and you don't have to be in a suit and all of that, right? And just tuning in for however much you want. Will people come back and be a community again in the rich and nuanced way in which human communities are intended to be communities, right? Because I mean, you've seen this as well. I mean, I've taught all of my classes last year, well, for about 18 months online. Thank God for Zoom, because without it, we could not have had classes altogether, right? But doing a class on Zoom is not the same as doing it around the table in a room together, right? It's just not the same, because we human beings communicate not only by what we say. As a matter of fact, I actually read some of this. People who study these things say that only about 15% of what we communicate is through the words we say. The other 85% is through our body language, the tone in which we say it, the clothes we're wearing, the particular body movements we make, all kinds of things like that, right? How we're sitting, all of that, right? And none of that is available on Zoom, right? Let alone being able to reinforce connections with each other, by joking around together, by eating meals together, by singing together. You can't sing on Zoom. One of the things I really love about services is singing together, right? But you can't do that on Zoom. So will you be able to, will we come together again when we're able to come together again? Certainly, hopefully so. And hopefully that, because people will recognize that as important as being able to communicate through Zoom has been for us during this pandemic, it's just not the same as being a full community in the rich sense of what that means. And yes, I mean, with the way that will be treated by the law committee is that once we, God willing, are over this particular variant of the virus, and hopefully there will not be others, because people will get vaccinated, and so we'll, because that's part of the reason why we have a new variant, is because it started in Africa, where a lot of people could not be vaccinated. There they could not be vaccinated. It wasn't that because the vaccines didn't exist, right? It's not the American libertarian reason. I don't want to, because who are you to tell me to be vaccinated, right? But the reason why these variants happen is because we don't have herd immunity. And the reason why you don't have herd immunity is because not enough of us worldwide are vaccinated, right? So hopefully we will get there and have the herd immunity, and then be able to come back together again for shul and for concerts and for sporting events and movies and all of those, and family events. Imagine that.
And weddings and brisses and
Weddings, and you got it. That's right. Right.
Yeah, why don't, actually, Norman, thank you. Why don't we turn to Norman Lewis, who has a question too.
Rabbi Dorff, you mentioned triage, and you said you developed some rules that were trying to make it more equitable. Did you do any measurements to confirm that it was in fact equitable?
Well, yeah. So what we were trying to do, what Rabbi Nevins and I were trying to do, was to balance the need for treating the person in the room, right, which is what clinical medicine would require us to do as effectively as we possibly could, with the requirement of meeting the pandemic on a communal level, right? Because if we don't do that, if we don't engage in community efforts to combat the pandemic, then we will never be able to be together again as a community. Now, in terms of the equitable issues, right, the questions of equity, the way that that UCLA was interested in doing that, it's a public hospital after all. The way that it tried to address those issues was to do outreach to other hospitals that serve primarily minority communities, and to try to make sure that because UCLA is in Westwood, which is largely a white community. It's also largely a Jewish community, and so the idea was to try to make sure that other hospitals in the region would know that UCLA was open to accepting patients from their hospitals if they were overrun and UCLA had room, right? We were also interested in the much more long-term effects of this. What does it mean to train doctors and nurses who are African American or Latino, and what does it mean to up the numbers of those people, and to make and to make them once they are trained, to make them ambassadors to those communities about what good healthcare is about, what good medicine is, and to trust the medical community altogether, right? But these again are much broader kinds of efforts that the community of the American community as a whole has to do. And you know, we are not in the same place on these issues as we were 50 years ago, but we're certainly not where we need to be on these issues. And that really, especially given that we just had Martin Luther King Day, I mean, I think it's appropriate to mention that that this really needs to be part of what we do as a society in terms of trying to overcome some of these inequities. By the way, it's not just in healthcare, obviously. It's in housing, and it's in employment, and it's in education, right, among other things. But that's an issue that we as a society really need to face in a whole variety of different ways.
Thank you very much. Others who have questions? Okay. So going. Okay. So I'm just wondering, Rabbi Dorff, could you say you talked about the different approaches between you and Rabbi Nevins in the Tshuva about triage. Is there a way to, in the short time we have, to put a little bit more, give us a bit more sense of that difference? Maybe
Right.
maybe even to describe your perspective on that. Why was the public health side of it that you came down on, and what motivated you there?
Okay. The interesting thing, I mean, first of all, as I said to you, he was using certain sources that I very much believe in, and that are directed at what doctors need to do for their patients. Okay. What I was looking at was the sources that talk about, well, what happens when you don't have enough? Now, in the book, in Matters of Life and Death, what I talk about is the fact that there never that healthcare until very recently in human history was pretty good. We talked about this last time. Was pretty good on the preventive side, but not at all good on the curative side. And so scarcity was never a matter. It was never something that they had to deal with in terms of healthcare, because healthcare was available. It wasn't very effective until the 20th century, right? Except for the smallpox vaccine in the 18th century. But with the exception of that, until you get to the sulfa drugs, and then you get to antibiotics, and you get to indoor plumbing, and you get to all kinds of other things in the 20th century, medicine simply couldn't cure very much, right? So where do we have scarcity? We had scarcity in two places. We had scarcity in terms of poverty. And so there are some very, very pointed sources in our tradition about how the Jewish community was supposed to allocate its resources to the poor. Who gets it? Who pays for it? How do they pay for it? And remember that historically, Jewish communities were not rich. Historically, it was the poor helping the destitute. So we've got some really very pointed sources, going back to the Torah itself, Deuteronomy 15, for example, and the Mishnah and Peah and the like, right? Very pointed sources about how you help the poor and who gets what. And then the other place where the Jewish sources dealt with this, with scarcity, was in regard to redeeming captives, right? Unfortunately, during the Middle Ages, especially Jews living in Christian communities, were not allowed to do honorific work. Honorific work meant agriculture. And so they had to do work that was dirty, that is, they dealt with money. Dirty from a Christian point of view. And so as a result, you had a lot of Jews in the import-export business. And that meant that they were subject to highway robbers, and they were subject to being accosted by pirates on the high seas and all the like. And people who kidnapped them found very early on that Jews have this very strong sense about the need of pidyon shvuyim, this obligation to redeem captives. And so Jews would pay for that more than other communities would. This is still a problem, by the way, in Israel, right? The issue of Gilad Shalit. You remember that story, right? And the issue in Israel about redeeming its soldiers, even though that means, you get for one soldier who's alive, you have to redeem 200 that have murdered Jews in Israel, right? I mean, that's pidyon shvuyim taken to an extreme, but it's done for different reasons. That the Israeli army wants to make sure it realizes that its soldiers recognize that they'll be there for them no matter what, right? I understand that, but it really comes at a price, namely that then the non-Jews understand that this is a way to get what they want, right? So it's in those two contexts that the Jewish tradition faced shortages. And so what I try to do in the book is to say, well, if you use those sources, then what would that mean in terms of the distribution of healthcare? And what would it mean in terms of who pays for it? And what I try to do in chapter 12 of that book is to spell that out. In the tshuva that I did, I took some of those sources and one other source that I had not mentioned in the book to try to approach a shortage of ventilators, let's say, from a Jewish perspective, right? Now, what that led Rabbi Nevins and me to have as really interesting conversations of, what does pikuach nefesh mean, right? And the subtitle of his book, of his tshuva, is The Sanctity of Saving Every Life. And the subtitle of my tshuva is The Sanctity of Saving as Many Lives as Possible. So the question is, does pikuach nefesh, saving a life, that's very strong in our tradition, right? It's dochesh Shabbat, all kinds of things, that goes back a long way, right? Does pikuach nefesh apply to each individual alone, or does it apply to the community as a group? And that ultimately was what divided us. But in the end, we came to the same conclusion.
Thank you. Thank
Sure.
you. I think we'll see if there's maybe one more question. Otherwise, I want to just say a few words about next week's session.
Right.
And any final questions for tonight?
You've had enough of the pandemic. I don't blame you.
All right. So why don't we wrap up here? And if people would stay with us for just another minute. So next week, we'll be talking about end-of-life issues. And I'll be sending out sources as well for next week's session. And I'll just tell you what I told Rabbi Dorff in preparation for next week's session, that in some ways this series, I approached him, and it's really for next week's session. I wanted this session and last week's session too. But I really want our community to continue to engage with issues of end of life. I think it's a really important issue. And, as you know, as a congregational rabbi and as the rabbi of this congregation, I deal with this issue with families on a semi-regular basis. And I think we could all use a good dose of really learning these sources and understanding this issue, which one way or another, we all come to eventually, to really engage with it and understand it. And I'm really looking forward to Rabbi Dorff laying out some of those sources and having conversation about it. And I would say that next week is the first of what I hope to be a variety of conversations, maybe not with Rabbi Dorff specifically, but about that issue. So please, it's all my way of saying stick around, do a little reading before next week's session, and come ready to listen and maybe ask some questions as well. So
Good.
again, thank you, Rabbi Dorff. We really appreciate it. Thank you, everyone,
My
for being
pleasure.
with us. And have a wonderful Shabbat, everyone. Go hear the
Absolutely.
10 Commandments read on Shabbat. It's Parshat Yitro, everyone. And we'll be seeing you soon. Thanks, everyone.
Have a good week.
Thank you,
Okay.
Rabbi.
Thank you. Very interesting. Thank you very much.
Appreciate it. Thank you.
Rabbi Dorff, we wish you a negative test.
Thank you. On Sunday, we will find out.
Okay.
Okay. Thanks very much. And
Sure,
regards
thank
to
you.
Michael, okay?
I sure will. Thank you.